A lack of lockdown compliance is a massive contributing factor. Over 1,300 deaths in the metro, and the number is climbing. Motherwell and Nutnake, the hotspot areas. Long queues at post offices are also contributing to the higher numbers.
People are losing their lives. Others are not so lucky, and we are seeing a high rate when it comes to recoveries. But the reality of the matter is that people who seated at home observe all the protocols. Some of them have been victims of people who are all over the show. And that is why we're saying let's clamp down on that, make sure people comply. If they don't, the law must take its course. We don't want to negotiate or do anything. If you are a business, you are not complying, the law must take its course.
We are now averaging over 500 cases per day, which we raised the alarm, I think 2-3 weeks ago already, and this is a message that we've been preaching in terms of this process about compliance, and the Mayor said it so eloquently around the compliance process. So the numbers are speaking to us that if we don't do something quickly, the second wave appears to have a far more higher infectious rate. The younger are being infected, but people are getting sicker.
Residents are suffering from COVID fatigue.
We haven't seen any behavioral change, and out of ignorance, our people are assuming that, or are having this saying that says, no, Corona is gone. It is level 1, of COVID-19, lockdown. We still have a responsibility to wear our mask.
I think people are COVID fatigue. They are so tired of hearing about masks and sanitizing, and they are angry because many of them lost their jobs. The poverty is increasing, and so people just don't worry anymore.
Such a wonderful little holiday resort, and if everybody coheres to the regulations and they stay their distances and they wear their mask and just, what more do you want?
COVID-related death countrywide stands at over 20,000. The metro currently has over 6,000 active cases. Zolani Moya, SABC News, Port Elizabeth.
Thank you, Zolani. We stay in the